Statistics show an increase in TB deaths in 2020. This is mostly due to people with symptoms putting off seeing the doctor. A study by the Human Sciences Research Council and the University of KwaZulu-Natal is hoping to reverse this using the Vula app. Testing and collecting of samples from doctors' rooms and patient support is made easier. The first patient who was diagnosed in May has now completed treatment, and 10 others will follow suit. For more on this, Dr. Jody Boffa from the UKZN's Centre for Rural Health joins us now from Cape Town. Doctor, very good evening. Thank you so much for joining me. Why the need in the first place to conduct this Connect TB study?
Well, as you said, with COVID, we've been seeing a lot more people with TB going undiagnosed, untreated. We know that up to 30% of patients with TB symptoms actually first present in the private sector, and yet so much of the work that happens in TB happens in the public sector. So we did a study earlier with the HSRC, which looked at how patients with TB are managed. And one of the problems was that doctors were afraid to send patients for TB tests right away because of the cost to patients or the inconvenience of having to switch sectors to go for the test. So we started up this study hoping that we'd be able to help GPs map their patients sooner, get them diagnosed straight away and linked to treatment, whether that be in the public or private sector.
Okay, so the TB Reach, the study enables clients to receive their results via text messages. What else does it do?
Well, essentially, it allows the client to receive, to just cough up some spit right there on site with the doctor. And the doctor can then, we will then come to their office and transport that sample to the NHLS lab, where it'll be tested for free by the KZN TB control program. And then we respond back to the doctor through the Vula app with the test results, and we contact the patient through SMS and let them know where they can link to treatment depending on where they indicated they would prefer to receive it in the public or private sector. And once that's done, in addition to that, we have Adherence facilitators who support the patient through treatment by making calls and just checking in on them, seeing how they're doing, seeing if they're encountering any difficulties with the medication or accessing their medication. And so far, we've had really great feedback from the patients who've been receiving those telephone calls.
Adherence is key, isn't it? Because it's important for them to complete, the medication in order for them to get better, to get well.
Yeah, absolutely. And it's the sort of thing we don't hear a lot about, right? We often hear, oh, TB is curable, TB is curable. But people forget to say it can take 6 months or longer, depending on the type of TB you have. And it's not always easy to access those medications or take those medications. So we're around to help the person get to a quicker diagnosis, but also to help them make it through that process a little easier with a bit extra support.
Okay, so what else does talk to us about the Vula app, and also please talk to me about the first client, the first patient who's gone through this cycle as well, because it is critical in terms of what you're trying to achieve, isn't it?
Yeah, well, the Vula app has done wonders for us because what it's enabled the doctor to do is to simply collect a very small amount of patient information, transfer it to us through a completely safe exchange process. And right away, we can send a driver to them to collect the specimen and drop it off at the NHLS. Then in real time, we receive the result from the national lab, and we provide that to the doctor, again through Vula in a private space, so the doctor receives it in real time. And from there, we can let the patient know that their result is either positive or negative, and they can go on to connect to treatment. Once they do that, We can also follow up with any tests that are required, or if they're having trouble, if they need a sick note from their doctor, we can communicate with the doctor via Vula and be able to get that for them without costing them extra time and money to make that extra trip. We can connect to the public sector as well and know that they're receiving their treatment and that they're doing well on it, or if they're having any problems, we can help communicate that for them. And then, of course, it's the process of them going through treatment and them having a supporter that takes them through it. We've had, a series of patients who began when we began this project in May, who connected with us, some of them wondering at first, well, do I really need somebody to be contacting me and checking in on me? But even those, we have had some people who have had TB for a second time going through treatment, and they said, you know what? Going through this a second time was actually, I thought I was going to hate it, but it was so much better that I could do it with someone, kind of a cheerleader to support me through it, and also help. We're running this project in Etaquini at the moment, and we went through the KZN unrest, and some of the clinics were closed, some of the GP's offices were looted or burnt down. We were able to help them connect to places where they could receive their treatment during that time. It was just a big help, and this is something we hope we'll be able to eventually roll out into the public sector as well, just to add that extra layer of support to people who are on treatment.
So, we're still in the midst of the pandemic, COVID-19, and I'm sure it must have impacted on the treatment, even diagnosis of TB in the country, with people hesitant to visit hospitals or even doctors.
Yeah, and we see a lot of it, and I'm sure many of the people watching have heard about doctors who offer consultations through Zoom or over the telephone, just to make people feel more comfortable if they don't need to come all the way in. So this is yet another way that we can reduce the number of interactions that people have to make, because we do know people with TB have an elevated risk of having a serious response to COVID, since they already have issues in the chest region. And it also just, saves people a lot of the hassle and the inconvenience of having to make those repeated trips to the doctor just for secondary tests and picking up their medications and things like that. We can just make it that much easier for them. So this is, we're hoping to find more of those missing people out there, but also make those who would have made that contact a little bit easier by getting that diagnosis sooner, by getting them on treatment faster, and by seeing them all the way through to the end.
Okay, fantastic. Thank you so much for speaking with us, and good luck with that app as well.